Welcome back. Well, we may have enjoyed a warmer winter than usual, but it could lead to an increase in the tick population, which in turn leaves us at more risk to contract Lyme disease. Joining us now with advice on how to protect yourself and your loved ones against this awful, painful condition is Dr. Toni Thompson-Chittams, Director of TLC Pediatrics in Bowie, Maryland. Thank you so much for coming in on this Memorial Day. We appreciate it.
Thank you for having me.
You know, I was reading too, I thought was interesting, that children specifically are more prone to this or having Lyme disease. Why is that?
Well, children are more prone, of course, because they are, in this developmental stage that they're interested in their surroundings and they love to get out and they play. And so they're, are very adventurous in the woods, in areas where ticks are more prevalent.
Now, here's the thing. Do all ticks, not all ticks all Lyme disease? I mean, how, if you have one, I mean, it doesn't mean you're going to get it.
That is absolutely correct. All ticks do not carry Lyme disease. The ticks that are very infectious with Lyme disease are your nymph deer ticks. They are very infectious with this bacteria. So you're absolutely right. All ticks do not carry Lyme disease.
Now, Orsa, I know you have some pictures here. Do some of these show the type of ticks that you need to be worried about?
Yes, they do. This one, particularly in the front, shows the different developmental stages of a deer tick. And it's a small tick that I just recently removed from a child about 2 weeks ago. And it is definitely a nymph deer tick. And that tick is truly highly infectious with the bacteria that causes Lyme disease. And that bacteria is called Borrelia burgdorferi.
Okay. So what people at home really want to know, obviously, are what are the symptoms of Lyme disease? When should you be concerned?
Absolutely. Well, Lyme disease occurs in stages. So a child may present with fever, fatigue, and this characteristic rash known as erythema migrans. And when you see it, it looks like a bullseye. And sometimes children are unaware that it's there, but we know that that is characteristic for Lyme disease, and we treat. If this stage is left undiagnosed, a child can present with fever, fatigue, joint pain, particularly of the knees. The worst case scenario of meningitis is headaches, fever, stiff neck, meningitis. It certainly can affect the heart as well.
And it gets worse. It doesn't get better on its own without treatment.
Exactly.
Okay. So let's talk a little bit about treatment. I mean, if you catch it early, I assume the better. But what kind of treatment is out there for kids, adults, anybody that would come down with this?
It is a disease that's definitely treatable, and we, depending on the stage of the disease, we use a course of antibiotics. Of course, if it's in the early stage, the course of antibiotics is not as long as compared as if you're in the later stage. The course of antibiotics may be a little longer.
And what we're seeing on our screen right now is how to remove a tick. That's the thing. If you have one, those pesky things really get into your skin. What's the best process to remove them?
Well, the best process to really remove a tick is take some blunt forceps, go to the base of the skin, and apply slow, steady upward traction. Don't twist. Don't crush the tick. We used to think that we could use the suffocation technique when we would put Vaseline on a tick or alcohol, but the interesting thing about ticks, they take 3 to 15 breaths per hour. So that may or may not work. So the best way to remove a tick is take those forceps and apply slow upward traction.
Now, is there concern too, because I know they can really get lodged in there when you do pull them out, of leaving anything behind? And if so, you just kind of clean the area? Is that the best way?
Well, you can try to remove it, but if you can't, don't worry. Just clean the area with a good antiseptic and just watch. If Lyme disease is going to occur, it usually occurs 3 to 30 days after the tick has been attached. And the first sign, of course, is that characteristic rash.
Okay, and also something, obviously our pets as well, something we have to worry about. Same kind of technique with them as well?
Absolutely, absolutely, and you should check your pets for ticks. And talk to the veterinarian about in terms of what insect repellent that you should use for them as well.
And that's the other key. If your kids are going outside, there's insect repellents that can repel these ticks and try to keep them off.
Exactly.
Okay.
Exactly.
Well, Toni Thompson, thank you so much for coming in today. We appreciate it. It's definitely something you have to think about in these summer months when we're all outside playing.
Thank you.
All right.
Thank
Over to
you
you,
very much.
Allison.
Sarah, thanks. Up next, it's a sound that signals the start of Memorial Day weekend.
The Fox 5 Weather app. Look 10 days ahead or hour by hour. View today's video forecast and radar that can pinpoint your neighborhood free at your App Store or Android Market.